rallies and religious melas. 2 years and we still have many unanswered questions. We have doubts, queries, curiosities around this virus. To answer all of your questions, we have with us today Dr. Kunal Sarkar, Chief Cardiac Surgeon and Senior Vice Chairman at Medica Super Speciality Hospital in Kolkata. And along with him, we have Dr. Anand Krishnan, Professor at the Center for Community Medicine at AIIMS Delhi. We also have with us my colleague Abantika Ghosh, who tracks the health beat for ThePrint. Welcome and thank you for giving us your time. And I would request our viewers to please send in your questions and I'll take up as many as possible through the course of this episode. But before I go to viewer questions, I have, I have a question for Dr. Krishnan. It's been a harrowing, it's been 2 years that, has been very difficult for everyone, but especially for healthcare workers. And what my question is has this particular wave, this third wave, been any different for healthcare workers in terms of the kind of numbers, the kind of hospitalizations that they are seeing?
Definitely, this has been a different for healthcare workers in 2 ways. Number one, I think, as we all know, the load on the hospitals is much less. The need for oxygen, ICU has all gone down. So that's a good part of the difference. The bad part of this difference is that it has affected health workers in a big way. I think almost all hospitals across the board, a good proportion of their healthcare workers have been infected, they have been isolated, quarantined. So the larger impact of this Omicron has been on the health of healthcare workers not being able to provide care. So even though the demand has come down, the supply has also come down concomitantly. That is the cause of the problem.
Right. Right, Dr. Sarkar, as a healthcare worker, what is the situation in Kolkata, especially for hospitals? Considering the kind of positivity we saw there, the number of cases they shot up really quickly. So, particularly for that city, how has the experience been?
Thanks, Mohana. Thank you for having us. You see, it's as far as my recorded memory is concerned, which goes back quite a few years, I've not known many instances when Kolkata was head and shoulders above the country in many respects. And I tell you, this was definitely one of them, because since most people, outside of the sort of regional remits of Eastern India don't look back at the Kolkata numbers unless they are forced to, we were actually, when people were crying hoarse about numbers in Delhi and numbers in Mumbai, we were far ahead of the field. It looked as if we were running a different race altogether. Because the first numbers that came out of Kolkata were staggering. We had 40%, 50% plus positivity on the very few days when it caught the public imagination. And if you looked across the RT-PCR labs and hospitals who were doing these things, they were blowing their brains off because there were labs reporting 70-75% positivity. Like everything was positive. So we haven't really had the chance of being this positive over the last 3 or 4 decades. But we seem to have made it up in one way or the other. But as Dr. Krishnan said, mercifully, we had a tremendous positivity. I confess, much of it was self-inflicted. We were one of these old religious orders who wants to suffer self-inflicted punishments. We were doing that. We were in a complete flood of Catholic fervor on the 25th of December. Then we were out in the streets with the New Year, and there was a lot of administrative and government patronage for that. It started off with our Durga Pujas, and it all manifested, you say, as soon as the trackers came on and as soon as the RT-PCRs rose. It was an explosion of numbers. But fortunately, it took us a lot of coaxing to request our state health data people to release the hospitalization data. They're releasing the hospitalization data over the last 10 days or so, and which is more or less correct, I think, more or less correct. And if we track that as a proportion of the active cases, then we started off by around 5-6%. I think now it's hovering around 3% of the active cases that we are tracking in hospitals. And when we have a chat amongst us, some of the allegedly bigger hospitals of Kolkata, it seems as if that the need for beds have plateaued off. So it's not come down. I think it's too premature to say that we are on the descent of the curve. I don't think we've seen the descent of the curve yet, but perhaps we've hit a plateau, and let's see that whether we are kicked up again or we manage to find ourselves on the downward limb of it.
Right. Coming to you, Abantika, where, since you have been tracking politics along with health, what exactly is the significance of this Gangasagar Mela? And why is it so important for the government there to ensure that it happens?
So I think there's a lot of historical reasons for it. Some of it is historical, some of it is futuristic. So it goes back to, I think, at least it goes back a couple of elections when Mamata Banerjee was repeatedly accused of Muslim appeasement for a variety of reasons. But she's really moved on from there. And, we heard before the assembly elections, she was reciting Durga Stotro and all that. So now, she's sort of taken a Hindu turn to counter her Muslim appeasement charge. She's taken a Hindu turn. And I guess the government of the state did not sort of want to give BJP handle. If this was stopped, then BJP would have constantly, sort of gone after her saying, you stop Durga Puja, like they have been saying, you stop Durga Puja processions. So this would have been one more thing to it. And now there are a lot of municipal elections in the country right now, in the state right now, corporation elections, several of them happening across the state. But more importantly, Mamata Banerjee right now has national ambitions. And there she's up against, West Bengal BJP doesn't matter so much as nationally her image. If this thing of being quote unquote anti-Hindu stuck to her, that would have been very damaging. I don't think she wanted to risk it. Also, I think at some level, the state government was probably hoping that the court would just not allow it to happen, but that didn't work out. And the state government in its affidavit actually told the court that, we are okay if we go ahead with this Mela, we'll have all the restrictions in place. And today somebody showed me a very funny picture of this huge bloated puppet of the SARS-CoV-2 virus at the Mela. It's a travesty really, but there it is. Political compulsions have taken over.
Right. I think, nothing in the past, like at least in my memory, of course, I'm very new to the profession still, but how politics and science and health sort of intersect has really come out during.
Can I make a comment?
Sure.
I think I would definitely agree with. Obviously, being a doctor, we are simply not clever enough to interpret politics. We've stopped trying many years ago. But a couple of points over here, one is that in the past, as Abantika said, that they were probably half hoping that the High Court, when this matter went to High Court, even if you have a domestic quarrel over here, it goes to the High Court. So when it went to the High Court, you see, first of all, they had an extremely puerile level of arguments. If you read out the arguments that transpired in the court, it's almost like a script of a carry-on movie, really. It was all like pre-rehearsed. And secondly is, mind you, as citizens of this country, we have to remember that judges who have ruled very strongly in public interest, in pandemic, and taken down the election commission before, have not been suitably rewarded or recognized by the powers that be. That particular judge who said prior to the Bengal elections that he's going to hold the election commission responsible for culpable murder because Bengal elections results happened in May 2021, and we had the whole blast of the second wave on our faces from the end of May and June. But you just look up your books and you will see that both the judiciary itself hasn't taken very favorably to some of their brethren who have ruled fearlessly in these matters. So I think it serves everybody's interest to be soft pedaling on this issue. So yes, there is political conveniency, definitely. But perhaps we would have expected a little more spine from the judiciary as well, which we didn't see.
Right. All right. Coming back to COVID and just pure science and health issues. So we have a couple of questions coming in from our viewers. So one question, in fact, this is a question that I also wanted to pose, is that about this variant. We do hear a lot of talk about this being mild, and we have heard statements coming from a lot of people talking about it being like a vaccine, which is I would like to reiterate, is not exactly a true, it's not a good statement to make. So Kumar Satyam is asking, is there any truth in an idea which is widely popular in US that once a person is infected with COVID, then that person is immune and does not have to take a vaccine? So does a person, I would ask Dr. Krishnan to take this up, is a person who has already gotten COVID immune to the virus?
So this statement is probably true for some viruses, but it is not true for coronavirus.
Right.
Because we have seen that coronavirus keeps changing, and it's so neither the vaccine, one dose, a complete dose, nor the infection is going to give you lifelong protection. That is not going to happen. I think that we all have to accept. It might give you some protection. It might prevent, as you say, serious illness or something for some period of time. Even that might wane after a long period of time. We don't know that yet, but it may not be. I may not be surprised if even this protection wanes over a period of time. So I don't think if we say that a natural infection is going to give you a lifelong protection, that is definitely not going to happen. We will. So if you don't do anything, you might get another infection somewhere along the line, and you can keep on having repeated natural infections. Or you could use vaccine to give some sort of booster, because the virus keeps changing. And,
right.
and there might be partial protection to future variants, but it is extremely unlikely that they will give you full protection against future variants. So I would not recommend natural infection as a way of protection.
Right. So my next question to you, Dr. Sarkar, here, Vineet Ambat is asking, according to a study led by a scientist from University of Cambridge, the Omicron variant is an evolutionary mistake, and there is no reason that the next variant could be milder. What is your take on this? So basically, the talk about, again, Omicron being mild, and we could as well see, more variants that are not that don't go the same way.
Well, it's very difficult to predict the way nature or sort of particulate evolution. It's not evolution of life as much as it is particulate evolution is going to go. I'll just tell you one thing, which is the moment, the kind of time when in South Africa, in and around Pretoria, when they isolated the strain and they had done the initial genomic samplings, there was a raging debate for about a couple of days. And they were not sure whether it is a common cold virus which has picked up the COVID characteristics or a COVID virus which has picked up the common cold characteristics. But finally, I think after a lot of virological hair splitting, they decided to include this in the COVID family. Now we already have 4 coronaviruses which are endemic in the human virological dictionary. We already have 4 coronaviruses which are a part of our pathological virological environment and which are endemic. Now, I think the more important question is that in the past, if you consider the natural history of what happened to H1N1, what happened to SARS-CoV-1, what happened to the other fellows, that when a virus becomes more transmissible and less virulent, Is it in some ways, is it following the path towards endemicity? I think that is perhaps the most important question. And a very interesting quote, I remember hearing Dr. Gagandeep Kang in one of our recent conversations. And when somebody asked her that is this going to be the last variant, then she said very poignantly that, have you seen the last cyclone? We haven't, So we have to be prepared, whether it was biowarfare, nature, a Chinese mistake, whatever we believe in. But definitely in terms of infectious diseases, there are going to be more things thrown at us. But as far as this this COVID family is concerned, whether this is going to be the 5th endemic member of the coronavirus family in the human system, let's see. But some of the script is unknown to us, because you only look at history, you can look behind that history. You can't look forward that history. So.
Right. So, coming to Abantika again, we did talk about the Gangasagar Mela. There's also, the Mekedatu Padayatra happening. What is the situation in Karnataka, and, what does that gathering mean for the public there?
So they've just suspended it after quite a few of their leaders. Former Union Minister Veerappa Moile has tested positive. Several others have tested positive. And I mean, we saw really horrific sights, of sneezing and sniffling DK Shiv Kumar in the rallies, and then saying that he basically said it's a BJP conspiracy to push the numbers up so that Congress cannot take this Padayatra out. But I think there's a pattern there. It's not just about Mekedatu or Gangasagar. We have seen that happening during Kumbh, and now with the benefit of hindsight, we know how Kumbh really took this virus to the remotest corners of the country. And I'm actually just a little surprised, maybe I shouldn't be, but I am a little surprised that all of these gatherings are still happening, these permissions are still being given, and we still believe, because see, one thing is that when you let the virus loose, the virus would have no boundaries, but we have very severe limitations of our health infrastructure. So when we talk about bed occupancy, hospitalization, we are essentially talking about data from cities. What is the situation in the villages? We know what happened last time. That's not what we want to see repeated. It's not about the numbers. It's not about the numbers we give out, the numbers we admit that died of COVID or did not die of COVID. The fact of the matter is people suffer. Nobody can deny that. And we are making those exact same mistakes again. That is what is a little surprising for me.
Right.
If I may add, see, I think again, even Tamil Nadu has allowed Jallikattu to be held. So while in an ideal situation, scientists like me, Dr. Sarkar, don't want this, but prefer that these things are not done. But I think ultimately in the real world, politics has to be accepted. People's demand to have this kind of thing. We'll have to start. All I'm saying is that we have to find a middle way. We cannot have one extreme that don't do any of these things and the other extreme that do whatever you want. I think somewhere along the line, our society, the scientists, the politicians have to find a middle path where we are comfortable with. There is no right answer for this. It is simply not done for scientists to say it is wrong. Because how long can people continue to be asked not to do anything like this? So somewhere along the line, society will have to find a way out of this situation.
Right.
Mohana, if I may just add a line over
Yes,
here.
yes.
Perhaps one of the most baffling paragraphs I've listened to in recent times is the opening remarks made by the Chief Election Commissioner when he was announcing the election dates. Because he started off with a constitutional thing, blah, 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 etc., and made a lot of epidemiological remarks, most of which were irrelevant to the elections happening in the states where it was happening. But you see, I ask a very simple question. When is a country with scientific ambitions and self-independence and whatever claim to a lot of scientific feats, Why can we not recognize that what are the public health criteria? What are the public health data sets? At which point we are going to recognize that this is a problem? Is the state vulnerable? Is it highly positive? Are we going to expose a lot of people? We already have data from all these places in the last 2 waves. How badly they have suffered? What are the consequences of a raging pandemic? So this is not a qualitative impression anymore. It is available in society as a data. So we talk about electoral swings and how Muslims have voted and Hindus have voted and women have voted and men have voted. But when it comes to decision making, public health data seems to be completely lost. So we are still have a very primitive level of discussion when such far-reaching decisions are made in our country. And just a second point I'll tell you is that don't look for the consequences of Gangasagar Mela vis-a-vis Bengal or Kolkata only. The impact will be felt in eastern UP and eastern Bihar. Parts of the country which are probably not exposed to this wave yet, I think we have just facilitated that. Because a good 60-70% of people, very simple people who come to attend this, they are not natives of our state. They travel a long way. There are special trains and stuff like that. So we need to keep an eye open. What's happening in Eastern UP and Eastern Bihar in about a week's time will be a point in question.
Right. So, as you talked about UP and, the effect of this. So I have a viewer question. Has Uttar Pradesh peaked? I'm assuming this is about number of cases. Has Uttar Pradesh peaked given the slow rise in cases there? Dr. Krishnan, would you like to comment on this?
Frankly, I have not looked at the Uttar Pradesh specific data, but I doubt any state in India has actually peaked. I think we are going towards the peak. Numbers are, as Dr. Sarkar said, but they're reasonably stabilizing in at least the bigger cities like Delhi, Mumbai, Kolkata. I cannot really comment very specifically on UP, but I doubt it would have peaked. I think the peak is yet to come. Most likely, my guess would be that peak is yet to come.
Right. Abantika, you wanted to?
So, I'm not sure what slowing means because, and I'm looking at yesterday's data. So between yesterday and the week before, so a week, I'm looking at a 7-day period before yesterday, and active cases in Uttar Pradesh rose from 3173 to 44,466. That is 14 times as many active cases. So cases have certainly not slowed there. The rest, peaking and all, it's not for me to comment, but this is where the figures stand right now.
And also remember,
and just one more point. I think ultimately we have to, these numbers, I'm very hesitant to interpret this number of cases because this is entirely a function of tests.
Absolutely.
Who's being tested and how much test is being done. So I'm extremely hesitant to comment on numbers from any state. It's not a state-specific issue. It's a generic issue.
Right. Also, we have shifted our, focus on, not testing everyone and going to like home tests now. Another question, this is specifically for you, Abantika. I have, can she tell us what is the level of preparedness among hospitals and states that are going for election? Is there any special provisions for these states by the government? So, apart from election, also in general, how prepared are our hospitals? What are the kind of surges that, they're seeing right now?
There's one, I can give some of the figures that are already in the public domain. And we can make our own conclusions from there. These are figures that have been given out by the government of India at various points of time. One figure is, this was around November last year, when Dr. V.K. Paul told us that we are prepared to handle 4.5 to 5 lakh daily cases. And this is with a predominant Delta strain. Now, again, earlier this week, when Health Secretary Rajesh Bhushan wrote to states, he talked about the second wave, which was driven by Delta. At that point of time, he wrote that the hospitalization rate, if I remember correctly, was about 20 to 23%. But right now, we are looking at a 5 to 10% hospitalization rate. So going by those numbers, and also going by as we were talking, I was checking some of the data in our cities, which again could be misleading, because as the virus spreads, these numbers will get very problematic. But in Delhi, for example, we are seeing such a huge number of cases, but the COVID hospital bed occupancy, that's just about 15%. In West Bengal, I was looking up, I think about 29,000 of 33,000 odd beds are vacant. In Maharashtra, I think less than 10%, if I'm not mistaken, is occupied. So currently we look comfortable. But here's the problem. We know from the Delhi experience, and I think Dr. Krishnan mentioned early on, beds don't cure people, doctors do. And huge infections among doctors. I don't know, maybe our experts can tell us if we are late with the boosters, but clearly too many doctors, nurses, paramedical staff are falling ill. Now, if this trend continues, then we are headed for difficult times, beds or no beds.
Right. Would you like to comment on that, Dr. Sarkar, about did the boosters come too late for India?
Regarding boosters, two comments, Mohana. One is, yes, we were shuffling from the right foot to the left foot far too long to decide on the boosters, because we actually had a kind of comfortable 3-month window with us when we had an ample and an excessive supply of vaccine. We had a surplus of vaccines. So it was completely confusing that why did we delay the decision on boosters when we did. Second point regarding boosters is that India is taking its booster policy with a pinch of salt, simply because repeating the second dose, the same vaccine 3 times is really not considered to be the most potent booster wherever you look around in the world. Because if you go by Oxford's own data, then giving a 3rd dose of Covishield will probably give us a kick up of around 3 times. But unless you effect a kick up of around 7 to 10 times in your baseline antibody levels, that boosting is not a very effective boosting, and which was only achieved. I think we are kind of paying for our indecision or whatever. We couldn't get the ranking between Pfizer, Moderna, and Government of India sorted out. So we are definitely missing the fact that we do not have any supply of RNA vaccine. So we are missing that. And it is told that when and if we have Novavax made available in the public domain, the subunit vaccine, Novavax, then that probably in some very limited work has shown to give a kick up of 10 times or more. But I'm not very sure that when is Novavax going to make its entry, and will it be made available as a booster dose for the frontline workers? So, I'm not terribly sold on the idea. Yes, we were late with the times, and I hope I'm wrong. But I'm a little bit skeptical that ultimately what effect this precautionary dose is going to have and the people who are receiving it. I think a study has to be done to record that what kind of antibody boostings have been given. We will be the only country who will have a data set of repeating the same vaccine 3 times. So I think before it gets too late, we better collate. I think I will request Dr. Krishnan and people from AIIMS and all, before you vaccinated a few crore people and get to the conclusion that we haven't done a very clever job of it, you better get to do an interim analysis and tell us that what kind of antibody kick-ups are we looking at? Because so far, we don't have any robust data that tells us that repeating the same thing thrice has been very clever anywhere.
Right. That actually has been, even most of us were expecting that since the approvals for the 2 vaccines came just before the announcement of the booster vaccines that we will go for mixed vaccination, but that did not happen. I have another question. I'll direct this to you, Dr. Krishnan, since you're a community medicine expert. Will imposing heavy fines curtail violations? So basically, does such impositions help to do fines, really work out in such settings to prevent infectious diseases from spreading?
As a public health expert, I'm generally not in favor of using penalties and banning certain things of behavior. So I'm not an enthusiast who advocates use of penalties and laws to change human behavior. As a rule, I don't support that kind of an approach. In an emergency, in a very extenuating circumstances, maybe yes. But as a general rule, I would never subscribe to such a approach. In the given context, we know everybody in almost all states, people have been penalized for not wearing masks in the public, and this keeps on happening. There's a constant, maybe it is necessary to some extent, but still, personally, I am not in favor of imposing penalty. Even in the current situation, I would not be in favor of imposing penalty for non-masking. And we have gone to the extreme of within the car, you should wear a mask and all those kind of things. Clearly unnecessary. There cannot be any doubt about it. But they made a rule, even court upheld it. What can one do beyond that? So,
right. So
Mohana, I'll just tell you something interesting in half a minute, which is not too far away from Kolkata. Is a part of the city called Diamond Harbour, where Mr. Abhishek Banerjee, our chief minister's nephew, is quite a young, energetic gentleman. He is the member of parliament, and there were an upsurge of infections over there. And very similar, if you recall what was happening in April 2020, we were all referring to the Bhilwara model, much before the days you had the large number of RT-PCRs and all that. So this is like the Bhilwara model with a bit of testing. I tell you, they had a very stringent imposition of lack of gathering, wear masks, the police, district magistrates, everybody is come out very acutely on that constituency. And I tell you, I haven't verified the data, but as far as the data set Dr. Krishnan they're giving us is in a matter of a week or so, they've got the positivity rate down from some 30-odd% to they claim 2%. Now it begs verification, but obviously they are not perhaps they're not very durable. They don't last very long, because if you are very stringent on people, they will find their way out. But it's some form of a human endeavor, a human experiment in a very limited area in this high positivity rates. But there is a claim that the positivity rate has come down to such an extent. Let's see whether it lasts or not.
Right. So in fact, I mean, since this pandemic sort of dragged out a very long time, it did become increasingly difficult to, keep imposing fines and bans, and it just did not work. One last question from viewers. Akshita is asking, would like to know about plant-based virus inactivators like Irezavir, which have oral and nasal sprays. So she's asking whether such oral nasal sprays which claim to sort of clean your respiratory tract from viruses, do they really help prevent the disease? Abantika, would you like to take this?
Not with two doctors on the panel.
Either of you.
Mohana, a quick comment about this is that, you see, there are different kind of nasal preparations available. First of all, don't go for local antibiotic things. They don't work as well. Secondly, yes, there was a lot of thing going around with local nitric oxide sprays, because nitric oxide sprayed on mucosal surfaces was supposed to kill the viruses, etc., but probably not huge results in the clinical perspective. Then there were some people who wanted, who were trying to make it popular to have frequent nasal washes with various stuff. So you see, there is a consequence. You may be able to sanitize or keep your, because the nose and the mouth is exposed to the atmosphere. So you may be able to keep it a little bit cleaner. But the expense, the price we pay for that is, there are very specialized cells in these lining epitheliums called goblet cells, etc. So you introduce a lot of hot water and things very energetically inside your nose and mouth all the time. You may up ending, damaging some of those natural immunity mechanisms. But probably what will be of interest, and I think, we keep on hearing it's coming next month, but it never has, which is the nasal vaccines. Because with the nasal vaccines, it will give us higher levels of IgG and IgA, which work locally. Because the current crop of vaccines we have work systemically. They do not have sufficient blood concentration to go into our nasal and sort of oral mucosal epithelium. So when those fellows come up, and if we have something which give us in combination with the vaccines we have received, probably they will be better. I think for the time being, we need to be a little bit careful before we put in a lot of hot liquids and different preparations into our nose and mouth. It may end up doing more harm than good. Be a bit careful.
Right. So, the way to prevent disease, prevent COVID is vaccines. And if you haven't gotten a vaccine yet, do get yourself vaccinated, because that is what is the proven way to prevent, severe COVID. Thank you. And masks. Yes. Masks.
And masks. Yes.
Yes, absolutely. Thank you so much. Thank you for being here with us, for giving us your time and answering all these questions so patiently. And I do hope that the viewers had a lot to learn. And we will be back tomorrow again with another episode of the virus Decode. And we'll have another set of experts to answer all of your questions. I'm Mohana Basu for ThePrint. Thank you for watching us.
Thank you.
Thank you.